All right, so we've had a chance to do CPR. We had a chance to talk about CPR and the differences for infants and children, if that were to be a situation that you encounter. The most common cause of cardiac arrest for adults is obviously something heart-related, something medical. For children and infants, however, the most common cause of cardiac arrest is actually secondary to choking or drowning. And although those two things may seem completely unrelated, they are actually more similar than you might think. Drowning, really in almost every sense, is choking on water. It doesn't mean that you have filled with water. What it means is that it has blocked your airway. So in everyone, whether it's children, infants, or adults, we have different parts of our airway. We have our upper airway, our mouth and our nose. We have the back of our airway. It goes down our throat. If you were to feel down your own throat, you're gonna get to a bump, pretty easy to see, on me anyhow. That's the level of your vocal cords. If you continue down the trachea, it's gonna split into two sides, your bronchi, main bronchi, bronchioles, down into the alveolar sacs of your lungs. Now some of you are remembering a few things from high school biology, very good. But we're gonna talk specifically about the level of your vocal cords. When something, whether it is a piece of hot dog or a piece of popcorn or water, from being in the ocean or in a pool or falling in the bathtub if you're an infant, whatever the case may be, if something gets there, it's actually going to trigger it to close and spasm. Now that's on purpose. That's the way we're designed. That is so we do not fill with food or water. If you get things in your lungs that don't belong there, that is going to be a problem. Not really short term, although a piece of hot dog in your lung is not comfortable. Long term, your body's gonna try and fight it and cause what we call pneumonia, specifically if you breathe it in, called aspiration pneumonia. Now, that's a long-term problem, your body knows that, and so it will shut the doors, it will close those off. When you're in a restaurant and you start choking on a piece of food, or maybe you're taking a drink and some water goes down the wrong tube, that is your mammalian dive reflex. I'll say that again, mammalian, meaning a mammal, dive, underwater, reflex. And that is to close it off so you do not fill with food or water or other things that don't belong in your lungs. That mammalian dive reflex exists in all mammals. So if you throw your cow in the water or you choke it, it's gonna do the same thing. Dogs can actually control it better than other mammals. They can actually dive and go down in the lake and get things, which is pretty cool. But by the way, so can you. But you need to learn how to control it and learn how to manipulate it. When you are in a restaurant and you have water go down the wrong tube, you cough, you gag, your eyes start to water, it's a little embarrassing. But for the most part, mentally, you know you're gonna get through it. And so you relax, that spasm ceases, you get air and a little water down into your lungs, and slowly you recover. And water in your lungs is no problem. When people have a cough, they have all kinds of fluids in their lungs. It's fine. But you know the difference, that you're gonna survive and you don't panic. When that happens to you in the ocean, when you fall off a boat on your fishing excursion, or you bang your head in the pool and are unconscious, obviously that's not gonna work, or if you're an infant, you don't know that that's okay, because you haven't learned yet that that's okay, that's when that tightens up. So that drowning or choking victim typically cannot get that object out if it's in their throat on their own, or if it's spasming in the case of drowning, they typically don't relax that on their own. By the way, they will relax when they go unconscious. And if they go unconscious and float face up, which is unnatural, but would happen if you were wearing a life jacket, then they would be able to breathe the air that's above them. If they float face down in the pool, which is the more natural way for your body to go, your arms and legs go to the front, you spin face down in the water, that's the problem. Because now you are unconscious, you will start to breathe again, except your face is underwater, which isn't gonna go well for you. We need to get people out of the water or out of that choking situation as soon as possible. So if they are conscious and choking, we're gonna do the Heimlich maneuver. And you guys have heard this before. And yes, I'm allowed to say it. It is not illegal. It is not against the law. It's not against the copyright. Everyone relax. The Heimlich maneuver was not invented, but termed by Dr. Heimlich, and it's to try and push the air that's in your lungs up out of your lungs through your trachea. So fist underneath your ribs, other hand over top. This is for the other person, not for yourself. So we're gonna reach around them, fist under their ribs, other hand over top, and we're gonna go in and up as fast and aggressively as we can without causing too much damage to the person. But we wanna be aggressive. We wanna make sure that we give it a few shots and get it out of there as soon as possible. For infants, we're going to actually support their head and their neck. We're gonna flip them over. Casey can demonstrate this with the infant mannequins once we're done this short video. And we're gonna actually give them back blows right in the center of their back, supporting their head and neck, face down, hit them in the center of the back. That's going to push on the air that's in their lungs. Keep in mind, they're not full of water. Even if they've drowned, they're not full of water. That has blocked and there's still air in their lungs. So we can push on their back, release that object that's in there, or release those vocal cords if it happens to be a drowning incident. And you'll know, especially for infants, because they're gonna start screaming. So once they start screaming, that is a glorious sound, and we wanna hear that. For adults, if they turn around and start swearing at you, hey, stop doing the Heimlich, I'm fine, you idiot, that's perfect too. So Heimlich maneuver for anyone age 1 and up, and back blows for any infants that are out there, simply because we can flip them over and hit them on the back, and there's not the level of structural support of the ribs and muscles as you would once you start walking. So really, they say it's 1 and up, Heimlich, 1 and under back blows. The reason for that is structure of the ribs and strength of the muscles, not the actual age. So if they are 2, like Noah was, but he still wasn't walking, we could still flip him over, hit him on the back. That's gonna work equally as well as it would for an infant. So of course, use your discretion, but Heimlich for anyone 1 and up, back blows for anyone 1 and under, and it doesn't matter exactly their birthday, just take a guess, flip them over, hit them, and that's gonna help dislodge that object in their throat. For drowning, same sort of thing. If they go unconscious, whether it's choking or drowning, once they are unconscious, so they're not responding when we yell at them or pinch them, now we're moving into CPR. We are not dealing with a choking emergency in and of itself. We're wanting to make sure they get blood and oxygen to their brain, just like we did with anyone needing CPR minutes ago. So in that case, good, hard, fast compressions on their chest, which, by the way, if they did choke, it's gonna get that object out as well, because it's also compressing the air in their lungs, and that donut's gonna come right up into my mouth. Great. So we've done choking, we've done the AD, we've talked about children and infants, and we've done basic CPR. When we come back, we're gonna talk briefly about wounds, bleeding, burns, shock, and some medical emergencies. If you're not taking that part of the course, then it was great to see you. Be safe, good, hard, fast compressions on anyone that needs it. You're not gonna hurt them, and no fear involved. Just get in there and push. Thanks so much.